The Affordable Care Act, ACA, Obamacare as it's known, is not universal health insurance. Americans are not entitled to it. You see, under ACA, though health insurance is no longer voluntary, it's required by law. People still have to pay. What ACA does is to build on the current healthcare system with incentives for joining and disincentives for not joining. In this way, the government expects to expand healthcare coverage to many more millions of people and at least partially close the healthcare gap. This is the strategy. The law has created health insurance exchanges or marketplaces where people can shop online for the best insurance deals for their needs and wallets. They're assisted by people called health navigators who help them sign up for Medicaid if they qualify, or if they don't qualify for Medicaid, help them get government subsidies to pay all or some of the private policy premiums, if they qualify for those. When an individual doesn't qualify for either, he must find a policy he can afford, which could cost hundreds of dollars a month. A financial penalty awaits anyone who chooses not to register for health insurance at all. In 2014, the penalty was only $95, but it will increase to $695 in 2016. Will this combination of incentives and disincentives get Americans to sign up? The Congressional Budget Office estimates that 23 million people will still be uninsured in 2019. The uninsured will be immigrants who are not legal residents and those who are eligible for Medicaid but are still unenrolled. The uninsured will also include those who've been exempted from the mandate because they can't find affordable coverage, less than 8% of their income, and those who choose to pay the penalty rather than buy insurance. For ACA to work, for it to pay full medical costs for the very sick, the disabled, the elderly, and the poor, it's important for everyone, especially the young and the healthy, to join in. ACA needs to balance out the sick with the healthy, because that's how insurance works. It protects an individual against financial risk, that is, a financial loss he would incur if he had to pay all costs associated with an illness or injury. A person can't know if he'll get into a car crash, break a leg in a basketball game, or get cancer. His individual risk is unpredictable, but insurance actuaries can look at statistics for many people over a period of time, and the risk factor or probability becomes more predictable at a group level. Then actuaries come up with what they think is a reasonable policy price. To pay their own costs and to realize a handsome profit, the insurance company bills the customer a monthly premium, which amounts to a policy installment plan. Most months, a customer will be healthy, and his premium will help pay the health care costs of a person who becomes sick or injured. The payer is generally pleased to be well and to pay up, because he knows insurance will be there for him when he needs it. In short, insurance is based on pooling the risks and sharing the losses. If a person has no health insurance and needs medical care, his options are much more limited. He can pay the unanticipated out-of-pocket costs for care, he can rely on charity care, or he can delay or forego care altogether. Thanks to a provision in the ACA, young adults don't have to worry about health insurance as soon as they graduate from high school. They can remain on their parents' health insurance policies until age 26. After that, though, they're on their own. Many feel that while they're young and healthy, they don't need insurance. What they may not realize is something we learned in an earlier lesson. Young adults are the most likely group in a population to suffer from injuries, whether from car crashes, alcohol and drug use, or participation in sports. The average cost of an emergency room visit for a broken arm is about $10,000, and being uninsured can lead to serious financial problems if medical debt is incurred. Also, long-term health problems such as mental health often present themselves during young adulthood, and early medical intervention can make a difference. Obviously, insured young adults are much more likely than their uninsured peers to seek out treatment for medical problems. So young adults themselves benefit from having health insurance in addition to helping balance the risk pool with older, sicker Americans. Of course, cost is a major reason why those just starting out in their jobs and careers don't buy insurance. Nevertheless, efforts should be made to familiarize young adults with their insurance options under ACA, Medicaid coverage, tax credits to purchase private insurance, and a catastrophic plan if they're under age 30 and can't find other coverage. They should also be made aware of health risks for their age group and the benefits of having insurance just in case.